Hello and welcome to Transforming WHO, another episode of the video series where I talk to global health leaders, colleagues inside and outside of WHO about what we do in the World Health Organization, about transforming and changing the way we work. And today I'm very happy to be joined by my good colleague Alain Labrique, who is the director here in WHO headquarters in Geneva. He's the director of Digital Health and Innovation. And welcome, Alain.
Thanks.
And thank you for joining me. First, a little bit about you, Alain. You are Belgian and Indian by heritage, grew up in Bangladesh.
Yeah.
I heard you even speak Bangla.
Yeah.
And then you went to the US, did degrees in biology and epidemiology, Johns Hopkins in Baltimore. Then back to Bangladesh, working in the field, I believe, for a number of years around the turn of the century. Then back to do postgraduate degrees and work in Johns Hopkins on mobile health. Around the turn of the century, I guess that was sort of what do you came into. And then you actually became one of the pioneers in what we called mHealth back then. Also, approximately 10 years ago, you started working with WHO, engaging in this field. You chaired the first digital health guidelines development group ever in the WHO. So you're also a pioneer in that field. And then eventually in 2022, so after COVID-19, you joined WHO headquarters in your present position as director. So let's go back to the origins in Bangladesh. We have a picture of you in the field, so to say, in Bangladesh. Can we have the first photo up? So here's a young Alain, I guess, with your son in the field in Bangladesh, and then you worked very much in the field on Johns Hopkins programs, I guess, in mHealth. So take us back to that 20 years ago.
Well, thanks, Søren, for having me, and great to have this program to talk to people about what we do here at WHO. But when you talk about the turn of the century, it really makes us question how old we are. But no, it's interesting because I began life as an epidemiologist, as a field trialist, studying infectious diseases, studying maternal and neonatal survival, what was killing mothers and babies, but with preventable diseases that could be circumvented by things that as simple as micronutrient supplementation. But then as you started to get past those initial silver bullets, if you would, you start to, I find that health systems themselves can use strengthening, and both from the supply side and the demand side. So what we were looking at was generating robust evidence that this mobile phone revolution that was happening around us, as in the turn of the century, as you put it.
Yeah, we also had mobile phones in the 90s, and then they became smartphones.
Right. In the early to mid 2000s, we began to see massive leapfrogs in the physical infrastructure that Western countries had to put into place for basic communications. And so in a matter of 2-3 years, you started to have rural, remote parts of the globe connected for the first time. And what that did is unlock tremendous opportunity for people to reach out to the healthcare system when they had needs. It unlocked the ability for frontline health workers who are working often in isolation in very, very difficult parts of the globe to now reach out to expertise that they didn't have access to before.
So it basically made primary healthcare more accessible to the people, and also expertise more accessible to the primary healthcare providers.
Absolutely.
But how did you get hooked as a young scientist in the field? Why did you get hooked on this new technology?
So I was studying maternal mortality. Right? And so we're here reading day after day hundreds of verbal autopsies of women who died because of failures, multiple compounded failures. So we talk about the 3 delays. It's actually many delays that compound over that critical window. And then we began to see that as we were reading through these narratives, we also were studying near misses. So deaths that nearly occurred, but for some reason they were averted. And we started to see that the phones actually had these newly emergent phones in the ecosystem, whether it was one phone in a village or a phone that was shared by a family, that often served as the link between life and death. And so that was the trigger for us to say, okay, this is happening in the wild, as it were. Can we harness this as a public health intervention?
And the lessons learned 20 years ago, I mean, how do you use those lessons learned in the field in Bangladesh? How do you use that today?
Well, I mean, it's all about science, right? It's about how do we move beyond good ideas, shiny objects, to science, where you're testing these hypotheses.
Yeah.
You're asking yourself, could this work? Will this work? Is this cost effective? What does it actually do in terms of a measurable outcome? Yeah. And that's what changes policy, right? Yeah. Because until you take these good ideas that are happening, out there in the ecosystem, people trying things, and you apply the scientific method to these innovations, where you begin to be able to measure what does it actually do, what conditions are required for it to actually work, and then what does it cost, and how do we scale it up and implement it. And so, that's where my initial relationship with WHO began, because we were asking the important scientific questions that I just described, and WHO was the place where information and evidence was distilled and brought back to the world in terms of guidelines.
What we do in WHO, I mean, as the sort of specialized UN agencies in global health, as leading a normative function. So you joined WHO in 2022 as the Director for Digital Health. Then you actually inherited a global strategy for digital health that was approved at the Health Assembly in 2020. I can recall that because I was actually in the Health Assembly leading the delegation from my country back then. And we were also a big promoter from my country of digital health. Right. So when you came in 2 years later, so that was on the back of COVID-19, the strategy was in place. And I can certainly say now, having also worked with you, that you and your team have really taken it forward in implementing that strategy. That's very much about getting digital health accessible to people, speaking to digital literacy, etc., but also speaking to the regulation and the normative work in that field. Can you speak a little bit to how have you taken that strategy forward?
I think you mentioned the pandemic. For us, we saw that being an inflection point for countries. Yeah. For 40 years in some places, for 20 years in others, we have been seeing digital tools being used in a piecemeal fashion. Yeah. So digital band-aids, if you would, right? So can we get information to the public? Yes, let's use a text messaging approach. Can we support frontline health workers? Yes, let's use a decision support tool or electronic health record. But these solutions were often piecemeal, isolated, not taken as a system. What COVID did and the pandemic realization was countries that had not just these solutions in place, but they also had invested in architecture, which really was around how do we get systems to talk to each other. Governance, where there was regulatory pathways for new innovations to be considered and then approved for widespread use. Those countries often fared better in their ability to harness technology and apply it to the pandemic response.
The pandemic really proved that, no doubt about it. If a government, a country was more mature in the digital space, no matter if it was low, middle or high income, they performed better.
Absolutely.
And there's a huge traction now. I mean, in your department, your team, you track our member states and do they have strategies for digital health? I think it's around 120, 130 countries that actually have digital health strategies. And this, again, it's not only high income, it's low, middle and high income. We see legislation being passed. I believe Kenya, which is a very digital society, actually. I was there a couple of years ago. And they have actually introduced a brand new legislation on digital health.
Digital Health Act. Yeah.
This is really taking off. I have another photo of an achievement of WHO in this field. If we can bring up the second photo, which I believe is from 2023.
Yes.
This is the signing. So there you are, the ambassador of India here to the UN in Geneva, and then of course the Director General, Dr. Tedros. And that is unveiling the global initiative for digital health that was being promoted under the presidency of G20. India had the presidency of G20. Yeah. So that's basically bringing together member states, stakeholders, private entities, etc.
Exactly.
Yeah.
I mean, so I think that the pivot in the conversation went from digital piecemeal band-aids to this question of how do we achieve digital transformation in the health sector. Because what countries were asking is, we're seeing it, and you mentioned Kenya, we're seeing what digital transformation of banking looks like. We've seen what digital transformation of transportation around the world looks like. Buying plane tickets, booking a taxi. And again, it doesn't matter if you're in Nairobi or in Oslo, you're using these tools in a way that has transformed those two sectors. Nobody waits in line to check their bank balance or to transfer money.
Societies, but again, it's done around the globe.
Right. So the Global Initiative on Digital Health was really conceived as the platform for the acceleration of the global strategy, to make up for lost time that we might have experienced during the pandemic, but really as a way to say, how do we move from experimentation to transformation? And the focus is on foundations. So how do we take those 130 countries who have a strategy to now go from having a strategy to actually putting that strategy into motion, making sure the strategy is financed so that countries can follow in the footsteps of those like Kenya and actually build governance around this space. Who's in charge? Who's leading the architecture of how these systems will work? Who is declaring the standards that will be used by developers in the private sector, in the NGO space, developing these systems.
And tying them together with healthcare systems and other systems.
And making sure they're aligned to the health priorities. And that as the private sector gets more and more involved in this market, that they are building solutions that contribute to the public sector priorities and solutions that enable you as a human being to enjoy what we call continuity of care.
And of course also equity, making it accessible for the population.
Absolutely.
So we have a couple of other pictures. I mean, we spoke about Kenya. Can we bring up the third photo, please?
Fantastic.
So this is from Kenya. Kenya is very digitalized, as we've spoken about. So this is just a specific example of what you're speaking to. This is the mTiba system that they've employed in Kenya. Kenya is very digitalized. They already have used sort of digital currency, digital payment, the M-Pesa system. The mTiba is basically health insurance and health data. So various public-private insurance providers and healthcare providers, they will basically tie together in this system that you can download and use on your mobile phone. We have the next picture, please, which is another example also of a WHO-supported endeavor. So this picture is actually from the Hajj last year in Saudi Arabia. That's the annual pilgrimage to the holy sites in Saudi Arabia. We have the head of our country office back then, Dr. Adham, with the representative of the Minister of Health in Saudi Arabia. And what we piloted during the Hajj last year was basically a Hajj health certificate. It came out of COVID-19 technology, I believe, from the European Union, used sort of in basically how can you share and have that health certification. That was, of course, the vaccine or the tests. Now it's about health. Are you healthy? Because when you have a large mass gathering such as the Hajj. So I believe we had Malaysia and Indonesia were pilgrims were piloting this.
Absolutely. And Oman as well.
Oh, Oman also, yeah.
But the idea is similar to how we now have our Visa cards or MasterCards that you're able to travel around the world and have that as a verified credential that not only do you have money in the bank, but you're able to go to any ATM in the world and pull out cash that you can use in the market. It's because that's called public key infrastructure. It's the foundations where you can verify the authenticity of a piece of information that an individual is carrying.
It's interoperable, so various countries can use the same basically backbone, tailored to their health data. So if we had that in place as a global solution before the pandemic, I'm just saying, I mean, that would have been wonderful.
It would
if you think about the resources being spent and all the hassle, I mean, travel restrictions across borders and vaccine certificates.
And it's more than just pandemic readiness, Søren. It's also about just being able to travel with your family, knowing that if there's an emergency, like during the Hajj, that you're able to pull up a health record that's trustworthy, that's accurate, that can be verified by the hospital that's providing you treatment, and to ensure, for example, in Saudi Arabia, a pilgrim who's falling sick during this very important time of their life, gets treatment that's appropriate to their health history.
Yeah.
And so, we're moving towards a state where all of these systems now are leading us to support people in having access to their health information.
And also the role of WHO, basically we are providing and supporting this as what we call global public goods. I mean, we are making this backbone available free of charge. We are urging and supporting member states to implement it, and then you can lay it on top of whatever system you have.
Think of us as the very sophisticated phone book that countries share with us, the list of authorized issuers of these credentials. And we verify because we have strong relationships with 194 countries. And those countries tell us that these 5 units are responsible for issuing certificates. We take that information, compile it, and feed it back to the world.
And there's a huge potential also for basically getting more efficiency in healthcare systems and also for easier access to healthcare, right? I mean, that's for sure.
I think, you mentioned interoperability, and one of the things that WHO does is norms and standards.
Yeah.
And I think working with sister agencies like ITU, the International Telecommunications Union, we help make sure that where data is concerned, where digital systems for health are concerned, that we do have standards, which is really how we package information and how we share information.
And of course, one of the things we also do traditionally in WHO, we produce technical products, guidelines, handbooks, and often they are very, very massive. I mean, they can be easily be 400, 500, 600 pages.
Yeah.
Nowadays, we don't print that much. It's more PDF, but it's still not easy to access.
Right.
So one of the things we've actually are doing are the smart guidelines.
Absolutely.
Where we try and, again, make that accessible. Can you speak a little bit to the smart
absolutely.
guidelines?
So as we talk about standards, it's about using this standardized approach to packaging information, which is how to care for people, what drugs should be issued based on the current state of evidence, and making sure that those guidelines don't sit on a shelf for 10 to 20 years, but that as the scientific evidence becomes apparent, that it's available to the folks on the ground who are using that information
and also
to deliver
they can
care.
plug it into their systems, right? Whatever that might be.
So
and making it more dynamic, so we don't wait 3 years to update the guidelines if there's new evidence.
Absolutely. So the smart guidelines gives us a way to package that information in a way that's consumable by technology. But what's really exciting is that it enables local production. And we talk about how we want countries to be in the driver's seat of their own digital transformation. This is a big part of that. It makes sure that local entrepreneurs, local innovators can build systems that not only are standards-based, that talk to each other, but that integrate the best information that's currently available on HIV, on maternal and child health, on malaria. So as they're building the systems, they're not spending immense amounts of time coding the greater than, less than, what are the treatment levels, but they're actually focusing on the experience of the Kenyan user, of the Estonian user.
Especially with a strong focus on low and middle income countries and on primary health care.
Yes,
because
absolutely.
that's where we can change public health and global health on the ground.
It's where we can shift the needle using digital.
Another emerging technology in all of society is artificial intelligence.
You were going to come there.
There, of course, I mean, and these days it seems like AI can either fix all problems or AI will create all problems in the world. It's one of these divisive technologies, and especially generative AI, where you can basically feed it science and it will create the guideline or the technical product.
One could only hope, yes.
So WHO has now issued regulatory guidelines on how to responsibly employ AI, etc. I believe that came out last year. Some critics are saying that WHO was a little late to the game. Better late than never, they are saying. Were we behind the curve? Are we ahead of the curve now? What would you say?
So it comes back to foundations, Søren. If you don't have the solid foundations on which to build these edifices of technology, those aren't going to stand for very long. And so I think we're learning from perhaps the mistakes or the lessons of digital health, mHealth, and the eras before, recognizing that we do need to invest first in the foundations. So making sure that we have guidance on ethics. What is ethical use of artificial intelligence? Guidance on fundamental regulatory processes, because as you mentioned, generative AI isn't something we have built regulatory systems to be able to process.
Yeah.
Current regulatory systems for drugs and vaccines look at input A,
Yeah.
provides output B,
Yeah.
and does it do it predictably
Yeah.
and
But it doesn't
consistently?
capture all the algorithms and whatnot.
And now when you're
And-
talking about
yeah.
generative AI, it's like, how do we evaluate an intern
Yeah.
for medical school, right?
And who's
They're
responsible for the diagnosis if the diagnosis has been made by AI,
Where is
etc.?
responsibility? So now that brings in governance and legislation.
Exactly.
So it's putting those pieces into place so that governments can safely recommend, adopt, integrate these systems into their healthcare platforms without putting people at risk. And I think that's really, really essential.
Apart from ethics and legislation, I mean, this is also a very commercialized space, and it's sort of also bringing WHO eventually and public health authorities in countries, etc., closer to a commercialized space, which is maybe a little bit outside of WHO's traditional comfort zone, if we may. But how do you perceive that?
There's probably not a Ministry of Health out there, whether it's in the developed or in the high income or low and middle income, part of the globe, that there isn't a line of private sector developers standing there with AI-based solutions to address all of the pain points that ministry is experiencing. And I think part of the question now that ministries are coming to WHO asking is, how do we differentiate? How do we differentiate what works and what's maybe a shiny object in a nice wrapper, but that doesn't necessarily work in this context? So it's not to say that we have to build regulatory walls for the private sector to climb. It's about a dialogue. It's about creating space for conversation. What are the red lines that we cannot cross in terms of compromising the quality of care? What are the thresholds, we call them benchmarks, that have to be met for an AI model to be suitable in a particular space?
And of course also recognizing that we can't move ahead without public-private partnership. Just as it is, I mean, that's been the case for decades in the pharmaceutical area. I mean, most drugs in the world are produced by commercial entities, so we need to engage with that.
But Søren, this is where I think, especially in digital health, we have had a very important dialogue between the private sector and ourselves.
Yeah.
And extending that to our public sector stakeholders who we serve, right? The 194 member states, the ministries of health, who look to WHO for that leadership and guidance. And so by bringing partners to the table, we not only help accelerate the technological tools that are available to countries. So whether it's AI or digital health, we have had phenomenal collaborations with large and small and medium-sized private sector entities who have helped build tools for the greater good.
Yeah, and I would also say that, I mean, from my national experience, I mean, if the ministries of health and the health institution don't engage in that field, then others will.
Yeah.
And ministries of digitalization, ministries of innovation are popping up in many countries. I mean, so we need to engage in that field. And so does WHO. Of course, we also engage with other multilaterals, especially ITU, which is the UN specialized agency for digitalization.
And like you mentioned, the Global Initiative on Digital Health brings together many multilateral agencies, because we realized at the country level, governments aren't often discriminating between, this agency or that agency should be the ones to work with us. They want us to be working together, helping them achieve their goals. So these platforms that WHO hosts is actually the vehicle through which we can collaborate better and make sure we're pulling in the same direction. Because for years we haven't been, and I think that's been a massive pain point.
Alain, we have to touch about the current crisis in global health. I mean, with the announced pullback of the United States from WHO, and also we are losing currently a lot of funding in the global health space, not only WHO, other partners and programs in the countries. And of course that is devastating in many ways to global health, but that's also the reality we have to navigate in. How do you see that affecting what we're talking about here, digital health and accessibility and equity?
So as we speak, right now, we are engaged in a rapid assessment process because we recognize that with this sudden decline in technical assistance, in financial support to countries, especially in the development arena, there has been and there's no better word for this, a collapse in a lot of the fundamental data and digital infrastructure that was in place, largely supported by these massive programs such as PEPFAR and USAID, where a lot of resources were being put into helping countries build and maintain systems for reporting. And one of the challenges was that these systems were built for reporting on those programs, not necessarily strengthening the core capacity of those countries. And so what we've seen is with that resourcing disappear, we now have a lot of countries who are recognizing that those foundational investments hadn't been made.
Yeah.
And so the process we're undertaking right now is actually to measure what has been the impact. And there's been already a few surveys that have come to fruition that show, people being locked out of electronic health records, the costs of server time haven't been paid, et cetera, et cetera. So this is an opportunity for us to think collectively as the digital health and ecosystem.
Might there also be opportunities in this crisis of demonstrating efficiencies, of scaling up some of these new technologies, AI, etc., basically to cover the gap of...
It's central to what we're thinking. It's the core of what we're asking ourselves is what is the resilient, essential digital health infrastructure that a country can own, pay for, operate, without reliance on development assistance, external funding. What is that minimal technical package that can be put into place that, we had, before this crisis, imagined over the course of maybe a 5 or 10 year period, we would see a transition away from imported systems to locally grown systems. But this has now accelerated all of that. The urgency to act now has been raised substantially.
And it's there. I can testify. I was in Nairobi in Kenya, and Nairobi is sort of becoming an IT hub as well.
Absolutely,
Previously places in Asia was. So there's that transition also on the African continent. The last question, Alain, it's not only a challenge to WHO and funding. There's a broader challenge and crisis, if you will, in multilateralism that has been discussed over the years. Maybe a breakdown on the whole rule-based international collaboration. How do you see that with your experience in the field?
Yeah. So I think it's an opportunity for us right now, because one of the things that has kept me in digital health for so many years is the sheer energy and adrenaline that comes from working with so many different fields, disciplines, experts who come together, informaticians, computer scientists, subject matter experts, technical staff working in medical programs, all working together to ask the fundamental question, how do we use technology to improve and accelerate the health goals that we share? And to successfully do that, we need multilateral relationships, partnerships, dialogue. Building systems in silos has never yielded a positive outcome.
Multilateralism is not going away. Even there's a crisis, it will bounce back and it'll be stronger than ever. There's a future for multilateralism.
I hope, and we will continue to plug at that, because underneath all the politics, you have the fundamental understanding that interoperability of systems brings benefits to everyone, and that's what for us is the shining light at the end of the tunnel.
Wonderful. Thank you very much, Alain, and thank you very much for joining this conversation. Pleasure. And thank you very much, colleagues, for watching. And do stay tuned for upcoming episodes of Transforming WHO.